Welcome to this week's lecture. Gerald Dworkin is one of the 20th century's greatest philosophers of law, and he's, of course, examining an argument from J.S. Mill, and Mill is one of history's better moral and political philosophers. He had famous texts such as utilitarianism, so he's one of the main utilitarians that are studied, and he also wrote an important book called On Liberty, which kind of maps out the principles behind a liberal democracy. Liberal not in the distinctly political sense, but in a kind of freedom loving would be the relevant sense there. Okay, so we're going to look at some issues surrounding paternalism in medicine and law, just to give some context to see if it's ever okay for a doctor to simply overrule the wishes of his or her patient. Okay, here we go. Think for a second how good parents treat their children. Given the difference between a parent's and child's expertise in navigating the world in a safe manner, it makes sense for the parent's decision making to simply override the child's decision making from time to time. A difference in wisdom justifies a difference in who gets to make the most important decisions regarding a child's life. Until somewhat recently, our doctors thought of their patients a lot like parents thought of their children, think of their children. In the 1950s, it was not at all uncommon for a doctor to deliberately fail to tell his or her patient that she had cancer or some other deadly illness, so as not to quote-unquote needlessly upset the patient. Doctors would also routinely make decisions regarding the patient's care without having a robust discussion of the patient's options. Doctors were seen as the experts, and in the context of medicine, the general public was viewed as mere children. Nowadays, the tide has shifted, and the patient has a routinely exercised legal right to be informed of the options which pertain to her medical care and participate in the decision-making process. Hence, we have shifted from a fundamentally paternalist model of medicine to one which favors patient autonomy. Yet, there still may very well be circumstances in which it is appropriate for a doctor or other healthcare worker to either override or ignore a patient's wishes. This lecture, and those which we will engage next week on the topic of informed consent, largely revolve around this issue of paternalism. Our first article, by Gerald Dworkin, concerns the concept of paternalism as it applies to the law in general. It's also worth noting here that if you think back to last week where we had those four principles, autonomy, beneficence, utility, and justice, this is primarily an issue in which autonomy butts up against beneficence in both its forms, either the duty not to harm a patient or the duty to maximize the well-being of the patient. So even though we're using the language of paternalism, those two basic principles are in play. Because when doctors attempt to overrule or ignore a patient, their motivation at least is usually pretty good, even if it's improper. It's usually some sort of beneficence that is being pursued. And of course, the patient wants to make her own decisions because we value our own autonomous, free decision making and having that kind of control over our own lives. Okay. All right. So let's look at Mill's two claims regarding paternalism. J.S. Mill was a 19th century British philosopher, so 1800s, who wrote some very influential works on both ethics and political philosophy. As I just mentioned, his main work in ethics is called utilitarianism, and as its name suggests, it's a defense of utilitarianism. His main work on political philosophy, political as opposed to the straight ethics, is called On Liberty. The main argument of this text is that citizens have a basic right to be free to choose what kind of life they want to live, and restrictions on our liberty always need to have a very strong justification. This is where Mill's utilitarianism comes in. Remember, a utilitarian is one who thinks that the rightness or wrongness of an action is determined by the consequences of that action for the group affected by that action. Hence, there are two possible motivations the state could have for restricting a person's liberty. The state can restrict a person's liberty in order to prevent a citizen from harming others, or the state could restrict a person's liberty in order to prevent a citizen from harming herself. This leads us to the answer to question 1a, which asks about the two theses which are present in the quote from Mill that Dworkin analyzes. Mill states, "The state is justified in limiting a person's liberty in order to prevent her from harming someone else." That's the first thesis. But B, the state is not ever justified in limiting a person's ability in order to prevent self-inflicted harms. Regarding A, there is a famous passage in On Liberty which states that the freedom to swing my fist ends at my neighbor's nose. In other words, I can move my body as I like as long as I don't harm anyone else. Dworkin wants to argue against B. Dworkin does not think that the state is never justified in preventing a person from harming his or herself. And of course, B is the issue relevant to paternalism. As philosophers are prone to do, Dworkin offers us a very precise definition of paternalism so that the reader knows exactly what he's arguing for when he argues that there are circumstances under which the state is justified in overruling the freedom of her citizens in order to protect the person whose freedom is being limited. So again, Dworkin is offering the definition of paternalism so he can argue against J.S. Mill that sometimes, every once in a while, there are occasions in which the state should engage in paternalistic actions. So this is kind of like table setting. So let's be clear on what paternalism is before we decide when it's appropriate to behave in a paternalistic manner. So Dworkin defines paternalism as follows: the interference with a person's liberty of action, justified by reasons referring exclusively to the welfare, good, happiness, needs, interests, or values of the person being coerced. Dworkin notes that examples of purely paternalist laws are hard to find, since laws often have more than one type of motivation. Dworkin then gives a list of laws which are motivated primarily by paternalistic considerations. So our social security system requires all workers to set aside a portion of their income for retirement. And again, the primary reason for that is to benefit them. The assumption is people do a pretty poor job of planning for old age, so the state more or less forces everyone to do something analogous to building up a savings account. Our traffic safety laws mandate the wearing of seatbelts in cars, and in most states, helmet use on motorcycles. And again, that's because we don't want people to irrationally harm themselves by refusing to take these simple safety precautions, even though they're completely capable of understanding the risks and making the choice for themselves. We don't allow children to work. Again, that's for the child's welfare. Gambling is often prohibited as a vice which harms poor people who engage in it. So, as you can see, we definitely have laws on the books outside of a healthcare setting which are justified on paternalist grounds if they are justified at all. In the second column, Dworkin mentions that many states have laws which are set up to make it difficult for a person to refuse a blood transfusion on religious grounds. We will look at this issue a little bit closer in a minute. Dworkin then turns his attention to Mill's main argument against paternalism. On the sheet, which contains the reading questions, I wrote out Mill's argument and gave explanations of each premise, which I hope have made the argument very comprehensible. You should take a minute and reread the argument as I have stated it. So go ahead and pause there here if you want to do that. Pausing. Okay, so if you paused, great. If you didn't, let's move on. Look at premise 4. Premise 4 states, it is never possible to advance a person's own interests through the use of force. Or, if it is possible, this can only be done by committing an evil action which is worse than letting the patient harm his or herself. So Mill's main argument in support of premise 4 is that the individual is almost always in the best position to determine what is in her own interests. Hence, Mill is committed to the view that people are highly rational and much more competent than others to reason about what is in their own best interest. And this is kind of where Dworkin bases his critique. Is Mill right about this? A little later in the article, Dworkin uses the example of someone who doesn't want to wear a seatbelt as an example of someone who is not being particularly rational in regards to acting in accord with what is in one's own interest. Wearing a seatbelt is mildly annoying. Car wrecks are quite common, and it is certainly in one's best interests to avoid serious injury and death. Hence, look at the trade-off. Mildly annoying versus avoiding serious injury and death, or at least greatly reducing one's odds. So it's a really rational choice. It's actually highly irrational to not put on the seatbelt. Yet, before seatbelt laws were passed, people routinely drove without wearing them. Now, I'm just old enough where I was a kid before these laws were passed, and I remember my mom mostly yelling at me to put on my seatbelt, but it wasn't required by law, even for kids. And she would often go without her seatbelt, so it's kind of a so I remember what Dworkin's talking about: widespread irrational choice making just because the act is mildly annoying to perform. Okay. Another example. What about diet? Are people generally rational when they choose what to put into their bodies? Given our obesity epidemic and the low quality of fast food, the answer is that many people are not. If there is widespread irrationality which affects our decision making, maybe there are a number of cases in which others are a better judge than we are ourselves concerning what we should be allowed to do to our own bodies. Notice that this argument is centered on the consequences of one's decision making. If we are generally excellent decision makers regarding our own health, then presumably letting others decide for us what to do in a broad variety of cases would result in great harm. Yet, if we are demonstrably irrational as a group, then perhaps laws which force us to make good decisions we wouldn't otherwise make are justified. Let's look at a case which involves a medical context, and this will also serve as a nice transition to this week's discussion board, which asks you to interact with this case. Our third question, questions, multi-part, I guess, concerns a hypothetical scenario which involves a clash between a person's freedom of religion and her physical well-being. Imagine you are a doctor who has a patient who refuses a life-saving blood transfusion on religious grounds. Should a doctor in such a situation be allowed to simply overrule the patient's request to not receive the transfusion? In order to make the situation more realistic, imagine that the patient will soon be rendered unconscious due to perhaps blood poisoning or extremely low levels of oxygen in the blood. And hence, they'll leave themselves vulnerable to having such a transfusion performed against their will. Question 3A asks if in this case the doctor has the better sense of what is in the patient's overall best interests than the patient herself. Notice that best interests is broad enough to include both a patient's physical and psychological well-being. So if the question were merely about the physical well-being of the patient, it would be a no-brainer. Of course, the doctor is making a better decision here than the patient. But people's religious convictions are very dear to them. They often form a core part of a person's identity. So this kind of makes this question a little bit harder to answer. Question 3B is not as focused on Mill's argument against paternalism. You might think that even if the doctor does have a better sense than the patient in this case of what is in the patient's best interests, that the doctor still shouldn't interfere. Perhaps you think people have the right to make bad and even fatal decisions regarding their own health care. This appeal to rights would be more of a deontological or autonomy-based ethical consideration. So if you want to think of how one might justify the patient's rejecting treatment, one could argue that when you take into account the patient's physical and psychological well-being, that even a consequentialist like Mill could argue, we need to let the patient decide to maximize the good here. Or you might think, well, it doesn't really matter if it's a good choice or not. It's still the patient's choice. We have this fundamental right to autonomy. In which case, even if the patient's behaving irrationally, the patient is still free to do so. Now, your discussion board question this week asks, a question right in this ballpark, a question not that different from the reading questions. I just want to remind you that, I don't want fluffy answers where you're just giving your mere beliefs or convictions or opinions. What I want is what you think about the question and some supporting arguments to go with those thoughts. Okay, so I look forward to reading those discussion board discussions, and hope you're doing well in the course. You can always email me. For those of you who have access to the Prescott campus, my office hours are on the syllabus, so if you feel like you're getting stuck or behind at all, you can always stop in or arrange a time that works for you. All right, so good luck and take care. Bye-bye.